University of Johannesburg has 6 strategic objectives. Internationalization features as one of these objectives because excellence in research, excellence in teaching is part of the project. So our expansion northwards, as I've indicated, is a must-have, and this is why we are here today.
I acknowledge this important moment where we can collaborate with African institutes and universities, and I think more important is that we take collaboration, staff mobility and student mobility to a different level. And from the office, I would just want to pledge that our support to roll out the Memorandum of Agreement, and any support that you need from the health sciences or from the university, we're at your disposal.
I think one of the significant things with this agreement that we've signed with Evelyn College is the fact that it's not just a department-based agreement, but it's an agreement that is signed at the faculty level, which makes it to be a bigger agreement. So from the faculty perspective, we have several departments that have agreed to engage. For now, we're going to start pushing some aspects with the Department of Biomedical Sciences. We have the Department of Environmental Health, and then, of course, the department where I come from, the Medical Imaging and Radiation Sciences Department. The future prospect is that we are going to get involved the Emergency Medical Care Department, the Department of Sport and Movement Sciences, and also the department which is a service department, the Human Anatomy and Physiology Department. So we are really excited with this prospect of what is going to come. And actually, because our delegates came early yesterday, we had an opportunity to meet and engage between the 3 departments, and the prospect of the engagements are quite positive. They also had an opportunity to visit our facilities, so they are quite excited with the opportunities that are existing in future. And we would like to thank them for having chosen UJ and chosen to work with us. And we believe it's an opportunity that is going to be great for us in terms of capacitation of staff for both institutions, research for both institutions, and also for program development from both institutions. And having said that, we know that if we get that right, it will be boosting what is happening between both countries in terms of service delivery in health. So we're looking forward to working together with you, colleagues, and we are quite excited. Thank you.
We have an excellent opportunity, and the timing is right, because the institution now has a fully endorsed strategic plan which runs up to 2021. And of course, it's because we have related it to the electoral calendar. Normally we have elections in 2021. So we'd like to bring on board new policies from government. As you are aware, that medical area is fully supported by government wherever you go. So we need to take on board. Now, with the strategic plan in place, one of the things we thought we could do have an advantage is engagement, collaboration with institutions which mean business. And after scanning the environment, we came up with the University of Johannesburg. Initially, when my colleagues had a first trip and they presented to the board, as board members, we always question. So we questioned them, but they explained the benefits, and the Memorandum of Understanding was finally approved by the board. So you are talking about an approved document, fully supported, which we have also escalated to the authorities in Zambia so that they are aware. But just to give you hope, the number of students who aspire to take up some skills in the health sciences is exceeding 60% at our institution. And even then, when we look at the facilities that we saw in your laboratories, if only 1% can come there, which we are hoping the corporation will achieve, then you are going to see a massive enrollment. This we guarantee. The other thing is we have a number of private hospitals coming up, and we see that they need the analytical support, through the laboratory work. Looking at what you have done, I think that is the right way to go. We really are in a hurry to implement what we are going to agree to today. I believe that expansion, as you have earlier stated, is the right thing for Africa. We have seen in other areas like electricity, economy, there have been a push towards collaboration in the region. So we would like to see that it happens in the health sciences. We don't want to start everything at a go. We would like to start the way we are starting at faculty level and act as they want people to refer to it as the case study of success.
Except that we are looking forward to making sure that we activate the Memorandum of Understanding once signed. And we hope that as soon as we have dealt with the signing, we will go into implementation strategy around the MOU, which essentially might lead to identification of critical staff in both institutions, Zambia and here, so that there is very, very clear and no impingement in the operations. We know that there could be silent experts in Evelyn and active experts here, obviously for resource reasons. And if we are able to identify these, then our MOU will definitely remain very, very active. And we have no reason to make it dormant at all. So really, we are hoping that UJ for its period of existence will definitely backstop us a great deal in terms of curricular review and development in the first 3 areas that we might start up with. When we came with my colleague last year, we were completely mesmerized with the kind of facilities that we saw, particularly the anatomy department. So huge, so well kept, so well resourced. The emergency medical care, and I was itching to let my boss pass through, and I was happy that he did. And I think he got just as motivated as I was then. So really we hope and look forward to the best out of this relationship now and going forward.